back the next day. We got an order to stop the fluids. We just want an INT line. Check your order to your MAR. You got, if you're doing it the next day, you got to do all that again. Identify your patients. Wash your hands. All you need is a flush. I'm going to reuse this one, but in your competency, get a new one. Okay. You can come through. You can come on. Yeah, come on. You're fine. All right. So we're in our patient's room. We're going to just stop our fluids by closing the clamp. All right. We're going to assess our site, because if our site is infiltrated or infected, we can't use it anyway. Might as well just DC the whole thing and start another one. So if it's infected, what's it going to look like? Red, hot to the touch, maybe streaked. It may not be all red. It may have streaks in it. Yeah, and there should be complaining that it's sore. If it's swollen, cold, hard to the touch, it's probably infiltrated, because all that fluid's right under there, balling up under that site. Either one of those, you're gonna DC it and start another site. But this one looks good. We've already stopped our fluid. You can go ahead and unhook it. You want to take note of how much fluid's left in your bag so you can put that in your charting. I hold on to these, but you can get rid of it because the cap is open, so you're not going to use this anymore. All right, even in the hospital, if you're going to take it down, then put it in a red bag probably. All right, we need to flush this because even though it looks okay, we want to double check that it's still in the vein. So once again, we're going to clean that with alcohol real good. Get all your air out of this, just like you did when you started it. You're going to flush it with about 2 milliliters. Looking for swelling or for them to complain. Now, they've had fluid going through this, so it shouldn't hurt when you flush it, okay? It shouldn't even sting. Sometimes they'll complain that if this is maybe a little cool, they may go, ooh, but it shouldn't hurt when you do that. So as long as everything looks okay, you want to make sure you clamp it. That's what keeps it from clotting off in between flushes and medications. Make another J, put your piece of tape on there, okay? Every hospital has their own policy about how often you flush INTs, but you have to flush them and you have to clamp them off in between, otherwise they'll clot off and you're going to have to start another IV, all right? So this is done. You would just chart normal saline, IV fluids DC'd with approximately 200, you can make it up when you're in there, approximately 200 milliliters left in the bag, IV site without redness, edema, heat, pain, that you flushed it with 2 milliliters of saline with no swelling at the end of the site, no complaints of pain, and then how you left your patient. All right. When you are flushing INT lines or giving meds through an INT line, you do have to wear gloves. So when I came in here, I would have put on gloves to take it down to an INT line since I had to flush it. All right. If you're giving IV piggybacks, you don't. But if you're going to fool with an INT line, there's a chance you could get some kind of body fluids on you. So you do have to wear gloves when you're doing INT lines. All right. So all done with that. Now we need to take it out. All right. So we're going to put on gloves. We're going to come in, identify your patient, explain the procedure, wash your hands, got my gloves on. First thing I need to do is take this dressing off, all right, and I'll tell you why. So if you'll hold on to this and lift it just a little bit, you can hook your finger under that and pull it off. Because you want to, whether you're using a cotton ball, alcohol, or a 2x2 dressing, you want to cover it up before you pull it out. Because if it flicks any blood or fluid, you don't want it in your face. All right, so we're going to pull it out and apply pressure. What am I going to do with this? Check and make sure it's intact, right? Because if it's not, that's an emergency. Tourniquet, if you don't have a tourniquet, and I never carried them, so blood pressure cuff blown up will do just as good, but get a tourniquet on the arm, call for help. This is intact, so it can go in the sharps container, and you got to hold pressure until it quits bleeding. There's no special time. You got to hold it for 10 seconds or whatever. I don't take blood thinners. You can probably hold for 30 seconds on mine and it will quit bleeding. But my dad does. You may have to stand there 5 minutes. So your responsibility is stand there until it quits bleeding. And you can't, and I know nurses are famous for this. Hold your arm like this. You can't do that because if you come back and there's a big old hematoma, guess who's getting in trouble? The nurse, not the patient, right? Then we would chart for this. 20 gauge, 1 inch. You will know the size. You will have memorized the colors by the time you are have been a nurse about 2 weeks. The pink ones are 20 gauge, the blue ones are 22. But the label that's on it tells you what size it was, so that's where you'll get that information. But DC 20 gauge 1 inch catheter from right forearm, catheter removed intact, pressure held until bleeding stopped, no signs or symptoms of infection at the site, and how they tolerate it. Any questions? It's really, I promise y'all it's not bad. Not near as bad as Foley and some of the other stuff y'all have to do.
Really? See, we already done Foley.
I know.